Okay, welcome everyone. Sorry we're a few minutes late, but welcome to this December 2nd media briefing. And we will just dive right into the information here. Let me start with the cases confirmed as we continue to see more cases. And those cases continue to grow exponentially right now. We're at 14,812, 14,812. And the good news is, though, if there is any good news here, is the death rate seems to be holding steady at 170. It's remarkable that we're even at that number. I can just remember when we were at just getting to 100 and thought that was remarkable. So as we can see from the screen here, the area that continues to grow is that age group of the 20 to 29, not only on the 30-day, the last 30 days, but overall the historical data, that group, the 20 to 29 and really the 30 to 39 has been leading the entire way. And now we just had the doctor tell us that he's seeing an increase in the Caucasian population and the Chinese population. So that is something that is somewhat new, but and somewhat concerning as we see post Thanksgiving this population start to the numbers start to increase there. And you can see by the numbers here, if we can go back to the 30-day, great. You can see the numbers that spiking just recently over that period of time in the last several days. The other area that is concerning is the hospitalizations and where they're at right now. 72, that has increased dramatically over the last several weeks, and since we last spoke, I think we were in the 20s, and it has jumped dramatically. We're still in a position to accommodate everyone that needs to get attention in the ICU or med surge beds, but that's something that's a lagging indicator, which is concerning because we don't know what's headed our way, and we're seeing this not only obviously in San Mateo County, but throughout the region and throughout the state. So it's something that health is very cognizant of and making sure that they keep an eye on. On to the mobile testing. The numbers have been astronomical. Our testing numbers are well over 800 per 100K right now. And it's just been an incredible surge. Some of that brought on by the holidays, and some of that brought on by all the information out there about how quickly this virus is spreading. And you know, you look at the numbers, and we're at I think 840 something per 100,000. It's remarkable that we're there. And what I'm told is we're second in the state, just behind San Francisco, which is well into the 900s. So we'll continue to monitor that, because with that testing also comes the turnaround time. And we want to make sure that that turnaround time is not impacted, because that is where the contact tracing begins. It's important that we get that information back in a timely manner so we can get out in front of those who may have been in contact with someone who does come back positive. And just to give you an idea of the blueprint for the safer economy, and you know, we're looking at those numbers, and you compare them historically. We're at you know, the adjusted case rate for the 11/28 was of course 7.6, and that's what put us in the purple. But you look at it a week, 2 weeks prior to that, and it was at 2.2. So what a dramatic increase. And you look at the unadjusted case rate for the week of 11/29 at 15.2 compared to 11/9, which is at 4.1. So we're seeing a dramatic increase there. The positivity rate remains very good at 2.5, which is within the orange tier. And we have not received an update on the health equity metric, which is something that you know, we want to make sure that we watch very closely, because those are our most vulnerable populations. But between October and November, we've seen an 85% spike in new cases. So that is, of course, alarming. The state's actions, as we all know, put us in the purple, and now 52 of the 58 counties are in the most restrictive purple. All Bay Area counties are now in the purple with the exception of Marin, but we'll watch and see what Marin does. I think they are going to impose some further restrictions. Obviously, this purple tier has impacted a lot of outdoor activities, including places of worship, movie theaters, gyms, and museums, which must now close or move outdoors. Shopping malls must retain an operation of no more than 25% capacity. And indoor gatherings among members of different households are banned, and outdoor gatherings can include people from only 3 households outside, and that is from 10 p.m. to 5 a.m. And during those hours, no gatherings are allowed among households with certain exemptions. San Mateo County's move to purple will not impact schools that were operating before we moved to the purple. And but those who have not begun that implementation plan to return to in-person instruction must now pause until we get to the red or until an eligible waiver is signed. And so schools may also apply for a waiver to bring back students from grades TK to 6. And the stricter restrictions have been imposed to control that recent surge. Obviously, Monday, the governor has indicated the potential for further restrictions beyond the purple tier, and we're waiting to hear what those might be and how they will impact this county and businesses in this county further. So we will wait to hear that and certainly get that information out as soon as possible. Just a little update on the COVID compliance team. They are issuing citations now. I don't have the number of citations issued in front of me. We've received 747 complaints so far. The team has been out at all hours. We have issued warnings, and now we're moving to the citation phase. So those who have been issued warnings and have not complied are going to get citations, and they will increase the fines until they do comply. It is very serious right now that everyone complies, and especially businesses where people may be gathering. The cities with the highest number of complaints, 24% the city of San Mateo, 16% in Redwood City, and 10% in the city of Burlingame. I wouldn't read too much into that because I don't know how many of those businesses are repeat or multiple complaints about the same business. The most common grievances against businesses are not ensuring social distancing while in the business and not requiring masks. The total homeless served in our various shelters are at 176 right now. As all of you may have heard and was reported on, yesterday the Board of Supervisors approved the purchase of 2 hotels that will be converted to housing. One will be a senior low-income housing, immediate permanent housing, and the other will be transitional housing for the homeless. We're also looking at the Pacific Inn. We're looking at the Coastside Inn in Half Moon Bay, and there was a meeting on that last night. And we are pursuing conversations with that hotel to purchase it for homeless residential transitional housing. The Great Plates program, we just heard a little bit ago, that will be extended through January 7th. That is great news. It's a great program. Over 1 million meals served right now. It is truly amazing to cross that milestone. We've got 3,199 participants in that now, 69 active restaurants, and a great deal of that income generated from that going to those essential services workers and coming back into the community. So that truly is, and when you think about the seniors and those who can't get out being fed on a regular basis, that truly is a win-win-win for everyone. The Immigrant Relief Fund, 10,780 grants of $1,000 have been given out. They are 84% expended right now, and with a total of 12,365,000 contributed to that fund. The Mass Mobile last week distributed 560 masks and to date has distributed over 15,000 masks. It's more important now than ever that we get that vehicle out there distributing those masks. The message that we're sending to everyone right now is that this is the time to be extremely careful, to really be vigilant, and to make sure that you comply with all the regulations and requirements to operate businesses that are out there now. We are headed into some darker days before the light at the end of the tunnel. The good news is that there seems to be a light at the end of the tunnel, and we just have to be vigilant to try to get through this home stretch here. And this is that hill at the end of the race that everyone dreads. But the good news is the finish line is in sight like never before. So with that, Ellie, why don't we go ahead and open it up and see if there's any questions.
Just a reminder, you may ask questions verbally by clicking participant icon and raise hand button, or you can enter your question into the chat. And I see Henrietta Burrows with their hand raised.
Henrietta, how are you?
You are too, I hope. You said that San Mateo County was second in the state in terms of cases. I think yesterday I heard that Santa Clara County was leading.
Oh, I'm sorry, that was in reference to testing. We are second in the state in the amount of testing that we are doing per 100,000 residents.
Oh, okay. And in terms of cases, do you have any numbers?
I don't know, Sarija, do you have any idea? I mean, I know LA and certainly other places are way worse than us.
I do not know off the top of my head. Overall, the Bay Area's case rates are lower than Southern California and other parts of the state. And our case rates in San Mateo County are relatively similar to the counties right around us.
Yeah.
Also, you had mentioned that in terms of outdoor gatherings, the gathering should not extend beyond 3 families. Are there any specific numbers involved? Because, you know, there could be 3 families that consist of 6 people each or more.
Yeah, no, there are no specific numbers associated with that because families like you articulated vary in numbers. So, but we're asking people to use common sense too. I mean, you know, if you have a large family, maybe you want to restrict it to just another family member that you're visiting. So we're just actually asking people to use common sense because this is a difficult time. And I know it's hard to keep hearing this message, but we've come so far and so many sacrifices have been made by individuals and businesses. And we've lost so many people. It's just time to really bear down and try to get through the next 6 weeks or so before we start to see maybe hopefully this trend change and start heading into a different direction. And an opportunity, again, we're trying to buy time for those vaccinations to get here, and they'll start with the essential service, the essential health workers, and roll out after that in some fashion. We don't know what that looks like yet, but we're just trying to buy time to try to get to that phase so we can keep people from getting sick.
One last question. You mentioned that we're heading into darker days, but there is light at the end of the tunnel. What signs are you using as indicators of the light?
Well, certainly the vaccination that we see on the horizon. We believe that, you know, that could be in the county in a matter of weeks, hopefully, or within the month, hopefully, to start the vaccination of our healthcare workers, our frontline workers who have been so brave and been in the trenches with COVID every single day. You know, that would be great if we were able to get those vaccinations rolling to that heroic group of people who have really been battling this on the front lines. And then after that, if we could start rolling that out accordingly to the rest of the population, according to risk or whatever metric the state comes up with. And we are working on that now. Certainly our health system here is working on that collaboratively and planning for that in the near future.
Thank you.
I see the next question in the chat asks, recognizing hospitalizations have risen substantially in the county, Are there concerns for capacity, and what are surge plans if capacity is met? Have there been discussions or considerations for cross-county support as neighboring county officials express concern they may meet their capacity? What information is available on the one out of county patients who received care on November 26th and 27th?
Let me start, and I'll turn it over to Sarija because she'll have more in-depth information. But we do have surge beds. We've been planning, for this, but we don't want to be overtaken, and that's why we're trying to head this off before we get there, and that is, certainly something that we're aware of and something we're focused on. Now, remember, we also have those beds in the mobile field hospital that we could set up again at the event center if necessary, and those were 100 plus beds that we could utilize if necessary. But we still have availability of ICU and med surge beds in different capacities, but we don't want to get there. We don't want to use those. So, Sarija, do you want to talk about maybe the regional approach here and where we're at right now?
Yeah, so there's a very highly organized mutual aid system across county lines that's led by the county health EMS team and a similar team in every county, so that there aren't barriers if one county's hospitals happen to be shouldering more of a load than others. Each of our hospitals is actively working their specific surge plans, making decisions about anything that should be delayed. They're also trying to make sure that hospital capacity is available for every other condition that people might fall ill for. We don't want people to delay care, and we want access to be available for every condition, in which a resident may be ill. In general, hospitals in our San Mateo County community have been a resource in larger regional systems. So, for example, the 2 Kaiser facilities in San Mateo County work with all the Kaiser facilities within the larger Kaiser system, and Mills Peninsula within the Sutter system, and Sequoia within the Dignity system. So I do not know for the one out-of-county patient that might have been an within system transfer, but routinely hospitals are operating to make sure that there's the right level of care at the right time for whoever may need it. And the one thing I would just add to what Mike relayed, what the hospitals continue to plan for is the staffing that's needed at the ICU level and every needed level. So those heroic healthcare workers that have been on the front lines, how do we make sure that we don't tax them any more than is necessary? We can prevent the hospital system being overwhelmed so that our frontline healthcare workers can be able to do their jobs as excellently as they're capable of.
Great, thank you, Sarija.
Next question says, you mentioned about the cases among Chinese residents are on the rise. Can you explain more, and what are the reasons?
I don't think we know the reasons. We do know that the numbers after Thanksgiving, and we'll see probably more as we head into this weekend, before Thanksgiving and after Thanksgiving are rising. It could be family gatherings. It could be social gatherings in anticipation of the holidays. I don't think we know enough about it yet to really make a determination why. We have been focused on the Latinx community because that is where we saw the spread before. And as that stabilizes a little bit more, and I suspect we're gonna have to turn our attention to other communities too, and do the same thing to really start educating and letting people know that this is real and it is spreading in that particular community. Sarija?
Just a slight addition. So what Mike was referencing is looking at data for what we see in the increased cases the last few weeks from November 1st to November 21st. And the steepest rise has been among, by race and ethnicity, has been among white residents and Asian residents. I don't believe we have it disaggregated by within the Asian community, which Asian American population. All populations, we've seen an increase. All of the Bayside regions, North, Central, and South, we've seen a steeper increase. So trying to parse the data of the last few weeks in which we've really seen the case rate increase, it hasn't been concentrated in our lowest resource communities. It's across the board. So that's why we want everyone to find the resolve to help to get through these next several weeks. The temperatures, the isolation, all those things are making it harder to stick with the things we know are necessary, but we just got to find the way over these next several weeks.
Thanks, Sarita, for that clarification. Really appreciate that.
Next question asks, can you tell us anything more about the businesses being cited by the COVID compliance team? Is it the sense of the team that these businesses do not understand what they're supposed to do, or do some businesses or kinds of businesses have less compliant customers?
Well, I think that the ones that we're citing are just determined to not be compliant. And we're seeing them, some of these are gyms and other businesses that tend to operate at night. So that's where we're seeing it. But this team is doing a good job of getting out there. We encourage people to call 211 or to go to our website and complain if they see about it. I think it's really necessary now that all eyes be out there on these businesses, and that to the extent that people are violating it, that it's reported, so that we can go out and make sure we understand why. And maybe some of it is education. I can tell you that far more of the folks that received a warning have been compliant than not. It's just really that small amount of businesses so far that have not complied and refused to comply. And we will continue to increase those citations until they do comply, or we'll refer to the district attorney's office for action. But again, the vast majority of the businesses do comply once they get a warning.
I see Sierra Lopez has their hand raised.
Yes, Sierra, how are you?
I'm good. How are you?
Good, thanks.
Good. Sarita, I hope you're all as well.
If
My question is just a clarifying question on the surge beds at the event center. Are those beds also included in the dashboard figure of the 108 surge beds, or are those in addition?
I don't think so, Sarita.
I don't believe so, because on our dashboard are the staffed available beds by hospital. And that's physical infrastructure capacity of beds, but it's not ready to staff yet.
Got it. So then total surge beds would be around 208, including the ones at the event center. Is that
If we were to staff
accurate?
it.
I'm not doing the math as fast as you are.
So it says that we have 108 available acute care surge beds on the dashboard.
Yeah.
And Mike mentioned that there were 100 additional beds at the event center, I believe was the figure. So then together that would be about 208 beds in case we needed them.
Yeah, what I would say is for our planning, what we look at is every day is staffed and available beds, the top of the gray bars that has fluctuated from, today there's 9 ICU beds or 12 ICU beds, and I can't read the number from here of the acute beds. In addition, every hospital has their plans that are in that table you're looking at, that you would add the event center beds that Mike mentioned and what they could mobilize if they executed their surge plan, that beyond what they have in their walls today, they would go to a next level.
And I see the next question in the chat asks, how is the county enforcing quarantine and isolation for people who are exposed to the virus or who have tested positive?
Sarita?
So really we're supporting every person who's tested positive to understand what they need to do to protect themselves and others. And so that's an individual conversation with the case and contact investigator. And then if people have barriers to staying, away from others because of their household situation, then we provide them the supports, whether it's housing or food delivery or other supports, so that they can comply with those protections.
Great. Any other questions?
I don't see any other in the chat, and I see no hands raised.
Great, everyone. Thank you for being with us. We will be back in 2 weeks. And until then, please stay safe and healthy and take care of one another.